It cannot be stressed enough to present a professional resume to achieve your goal of future employment. There are many books that can also be found with different styles of resumes that you may want to look into for ideas. Remember though that keeping the cover letter and resume simple and to the point will make it easier for the prospective employer to read, and thereby may be the reason you will be called for an interview. When you have sent out a resume for review for potential employment, note the date that you mailed it out and also keep a record of the name and address of the office you sent it to. This will assist you when the office calls to schedule the interview, as you will be able to refer back to the advertisement and the qualifications and a description of the position for which you are applying. You will then be able to research the office and have valuable knowledge of the specialty the physicians are trained in, so that you will be prepared for your interview. If you have an answering machine at home, be sure that the message is not offensive. It is a good idea to record a message that is simple and to the point. When you receive a message from an office, be certain to write down the correct telephone number and the correct name of the caller who left the message. When returning the call to that particular office, identify yourself and state that you are returning a call with regards to a message you received for a position with the office. At this point, you will probably be asked to arrange a time for an interview. The interview, dressing the part. You have worked so hard on your job search and it has paid off. You got a job interview. Now is the time to really prepare in order to get the job. The first impression you make will be a lasting one and can be the contributing factor in whether a position is offered to you. Take the time to prepare for your interview before you get to your appointment. The first consideration is your clothing. This can be a source of stress to some, as you want it to be perfect, so decide early on what you will wear. Do not dress as if you will be going out with friends after the interview is over. Dress that is too casual may lead the interviewer to perceive that you do not care about the position for which you are applying. Personal hygiene must be flawless. Project a clean, well-groomed appearance. Your outfit must be neat, clean, and professional. For men, a dark-colored suit, white or light-colored shirt, and a simple tie are appropriate to wear. Women can achieve a professional appearance by wearing a suit, skirt, or dress with a low-heel, comfortable shoe. Avoid a strong scent and perfume that may be offensive to others. A professional look will exude a confident demeanor, which can only be a positive force when you're being hired for the position that you desire. Interview preparation. When searching for a job, remember the prospective employer that you will be speaking to is interested in finding out what you will bring to the office that will improve the way the office works. How will you fit in with the present staff? What skills do you possess that allow you to be the perfect choice for the position? The answers to those questions in the employer's mind are answered during the interview process. This is your opportunity to demonstrate the skills that you have developed and to prove to them that you are the right candidate for the job. Research the medical office you are applying to. Know what type of practice it is and the physician's specialties. Chapter 1, Volume 1 describes the different types of specialists that you may work with and the definitions of that specialty. Prepare for the interview by rehearsing answers with families or friends. Have them ask potential questions so that you may prepare your answers and write them down for review. Some common questions to expect are: what experience do you have for the position? Why did you leave your previous job? Name some of your strengths and weaknesses. Why do you want to work here? Tell me about yourself. What salary are you looking for? Answer all questions clearly and be confident when you answer. Some questions an employer cannot ask by law concern age, race, sexual orientation, marital status or divorce, children, religion, height, and weight. If you have been asked any of these questions by the interviewer and you are not comfortable answering them, you can state that you are not sure of the relevance to the position. The decision remains yours should you choose to answer them. The most important part of the interview may be arriving on time. Arrive at least 10 minutes early. This shows your interest in the position. When you arrive, you may be asked to fill out an application. Use blue or black ink only and write neatly and legibly. Read over the application completely before filling it out. Follow all directions and take your time to fill it out correctly, as some applications may be lengthy. The employment application will include your name, address, telephone number, social security number, education, work experience, and references. At the time you are called in for the interview, smile and greet the interviewer with a firm handshake. Do not chew gum. Bring your resume, copies of your reference letter, a pen and notepad. Pay attention and show interest at what is being said to you. Let the interviewer describe the position and ask questions that can help in determining if this is the right job for you. The discussion of salary, when asked, may be answered by stating that you are negotiable in your salary requirements. This gives you flexibility should you decide to accept an offer which is lower than what you are currently making, but offers other compensations. Try to remain relaxed in your body language and show enthusiasm during your interview. This can be demonstrated with a nod, smile, and maintaining eye contact and good posture. When the interview is finished, thank the interviewer for his/her time, shake his/her hand with a firm handshake, and express an interest in the position. Be sure to send a thank you note within 2 days of your interview, thanking any staff members who were involved with the interview process. Sample thank you note. Date, interviewer name, address, city, dear name. Thank you for taking the time to speak with me regarding the position of medical office assistant on Tuesday, April 2nd. I enjoyed learning about your practice and found the job description to be just what I trained for. I am very interested in the position and feel confident that I can be an asset to your staff. Thank you for considering me for this position, and I hope to hear from you soon regarding your decision. I can be reached at 555-1212 with any questions. Sincerely, Jane Jones. Employment opportunities. Refer back to the table in Chapter 1, Volume 1, Table 1-2. This table highlights the administration and clinical duties of the medical assistant. The information given will help you in your decision to obtain employment that is best suited for you. The medical field is growing each day. There will always be a need for compassionate, caring individuals to assist in the needs of others. Medical assistants account for a large part of that workforce. In a physician's office, the medical assistant may be involved in administrative and office management. Today, many physicians work in group practice where the physicians may have different specialties or they all practice in the same field of care. In a group practice, medical assistant may be assigned to a specific task that supports the entire group of physician, or they may be assigned to assist one physician working with a team of assistants. When working in a small practice consisting of 1 or 2 physicians, the medical assistant may be responsible for all of the administrative and clinical duties. This will provide you with valuable experience. The physician will rely on you to perform many duties, and with time and experience, you will be able to do a great job. Clinic settings also employ medical assistant. Clinic can be center for the treatment of many different types of illnesses. Clinics have specialists involved in the care and the treatment of the pediatric patient, wound care, pain management, orthopedic, geriatric, or mental health. The medical assistant may have the opportunity during training to experience working in any or all of the above settings. This affords you the chance to obtain skills in such a variety of clinical settings that you may determine which of the medical office interests you the most. The medical assistant employed by a hospital or medical center may work in many different aspects. or many different departments in a hospital setting. Medical assistant may be active in the admission, emergency room, laboratory and radiology, physical or respiratory therapy area. Surgical and medical floors depend on the medical assistant to assist with the hands-on care of the patient. Hospitals are constantly growing to maintain and striving to improve the quality of care for each of their patients, thereby making career opportunity a great choice for today's medical assistant. Today's surgical and medical patients now have the option of recovering in short-term care or personal care centers. This can include rehabilitation facilities that concentrate on improving the patient's status to the point that he/she may return home. A medical assistant can assist with rehabilitation and care under the supervision of skilled and trained professionals. Once hired, it is important that you maintain your professional and appearance at all times. Be courteous and polite. Work to the best of your abilities. Work hard, cooperate with the other staff, and work as a team member. Review your job description if one is available, fulfilling your required duties, and know that it is always appreciated to go the extra mile to help the other staff members. Performance reviews are done periodically and may be done at 90-day interval when first hired. This is the time to review your duties, and it is also a time where you may ask any questions regarding your position. If there are concerns involving your work, they will be discussed at this time. These evaluations can be extremely helpful in assisting you to improve your skills. This time is also used to let you know that you are doing a great job and that you have performed effectively. Positive performance review also can lead to advancement within the office and increase in salary, so it is important that you strive to do your best at all times within your work environment. If during your performance review you receive constructive criticism, accept it as a helpful tool to improve your skills. Do not be upset by this, as the only way we can learn and work to the best of our abilities is to strive for improvement. Performance reviews are usually written out on an evaluation form that the office has developed. They can state your position and the qualification for the position that you are doing in the office and how you are doing in accomplishing the task given to you. Your supervisor reviews it with you. If the evaluation meets with your approval, you and the supervisor will sign it, and it will be kept with your personal file. At times, a medical assistant may only be looking for temporary employment. This can be found through an employment agency and may eventually lead to a permanent position with the employer. The excitement in being hired for a job for which you trained and studied provides you with the confidence in knowing that you are prepared for the employment search process. Keep your skills current, have an excellent work ethic, and you will have no difficulty in advancing in the office setting where you work. Follow the rules of the office you are working in. Always arrive on time for your scheduled workday. Strive to work well with others in the office. This will lead to a pleasant work environment. Be happy. A smile and a caring manner can go a long way in achieving your goals to be the best you can be.